We are thrilled to, and I'm thrilled to be able to introduce one of the real tip of the spear individuals related to this movement, Dr. Carmen Rita Nevarez. I've had the privilege of knowing Carmen for, it feels like almost 15 years. She has an incredible track record and body of work around community health and collaborative leadership, and also around sort of the testing and the creation of health innovation solutions. Carmen is a public health thought leader. She has served as the past president of the American Public Health Association. She serves on the board of many foundations. She's actually, with all the other things that she's doing, finds time to practice as a community physician. Carmen will lead us into the next aspects of our time together.
Well, thank you so much, Milano, for that very kind introduction. I really am proud and so excited to have all of you here today and all of you in our listening audience. Part of what's really interesting about that slide that Milano showed is that we almost have every single state in the United States signed up for this 2-hour morning segment of what is actually a whole day for the people that are in the room. And I want to give a little shout out to the state of North Carolina, because North Carolina got 10% of the more than 400 people that were registered. So I don't know why, but North Carolina, thank you for being with us, because we really appreciate it, and we hope that you will help to spread the word. So let me just start by saying why we're here. We're here because we're building a national learning community to fuel local and statewide overdose prevention efforts. What I saw in the Wordle said something to me very, very personally. We're here about awareness, about building collaboration, and how powerful that is. In 2018, my organization launched a statewide forum for all of the coalitions in California that were confronting the opioid crisis. And what did we learn? We learned a lot of things that we thought really ought to spur us into action in connecting with people across the country. We learned that strong partnerships, leveraging assets already in the community, working across sectors, bringing everyone to the table, adopting what works and not reinventing the wheel really makes a difference. People do not have to do the same things and make the same mistakes that others do. There's a lot we can teach each other, a lot we can help each other with. So based on that, we actually now have enough people in California to cover 33 million Californians. That's what the coalitions are getting done, and it's really very, very exciting. So why do we think coalitions are important? Because they help to develop the local response by responding to community needs. The community gets to say, this is important to us. So there might be great federal policy or great state policy, but the communities themselves say, all of that's good, we need to focus on this other thing. And that's where we will help them to do that and help them to spread the knowledge and learn from each other. It's important because we're strengthening systems by generating dialogue between sectors. And you saw the sectors that are here present with us in the room and present with us across the internet, and that's really the strength of it. The strength happens when we all get together and try to understand and work with each other's perspectives and skills. And it's important because this is how we sustain action, by building and focusing on long-term solutions. So what's the how? We are helping to implement key evidence-based strategies. This is about poly-drug, not one drug, but many drugs. We all know that pretty much across the country, it's not just opioids anymore. We need to understand there are very dangerous combinations, and this is what we need to focus on and really start to put some effort towards. We need to look at upstream prevention and education, safer prescribing. We need to look at drug disposal and take back. We need to be managing chronic pain safely through alternative pain therapies, tapering high doses, helping people to limit opioids and sedatives. We need to treat addiction. We need to be about accessing medications for addiction treatment. We need to reduce stigma. That's a big part of everybody in this room has a role in helping to reduce stigma. That step alone will help bring somebody a little bit closer to getting their life back. We need to stop overdose deaths. Many folks here are engaged with and also helping others to learn about administering naloxone. We need to think about what is the role for syringe service programs in our communities. We are about sharing the learning, about spreading the impact. We've learned there's a need for alignment across geographic and demographic communities. One of the things we learned in California is that if you're in one community, you know one community. There's such diversity here, and in partnering with other people across the country and learning from them, we found many solutions, we found many trials, we found many opportunities to share experience, and that's why we decided to come forward with this idea of building a national learning community. It just makes sense. We can't afford to waste time duplicating our errors and not making the connections when we can really help each other. We need to improve cross-sector learning. We need to really share innovation. We need to build more evidence-based knowledge. We need to work on communicating impact, because this is how we're going to change hearts and minds. So this is just a little quick scheme of what the National Overdose Prevention Network is how we think of it. Right now, it's a national learning community where we're connected via the internet, where we connect at meetings that we go to, where we connect by resources that we share, where we connect by giving each other the opportunity to learn from our mistakes and to absorb our insights, and where we all, as an entire nation, start to look at how do we change what's happening in this country with respect to substance use. This is a chronic disease. We need to treat it like a chronic disease. We need to grapple with it and move forward on this agenda. In this, we are all together a community of learners. So what's in it for you? Well, we'd like to see all of you participate in national conversations about best practices. We would like everyone to have access to proven evidence-based strategies from leaders and substance use disorder coalitions from across the country. We would like to see connection to innovative new partners from across the nation, representing a variety of economic, ethnic, rural, urban, suburban communities. We would like access to counsel and a wide range of customized support. We want enhanced ability to influence state and federal and local drug policy. And finally, we want to make sure that everybody is linked to resources and funding opportunities. So this is something that we can do with each other in a web-based learning community, and by leveraging every opportunity that we have when we meet with others. So, to become a part of this community, we ask that you go to www.NOPN, that's NOPN for National Overdose Prevention Network.org, and register.